Well, first, let me just say that I'm really grateful for all the physicians and all the healthcare that I've had in the past 5 years. Really, truly grateful. And so my comments are really about the medical system and not the physicians that I've had. But that said, there have been really huge frustrations for me personally, and at a time where I'm physically and emotionally challenged anyway. And I think probably the biggest frustration for me has been about communication of information. And that's kind of a huge umbrella for communicating between physicians, communicating between facilities, emergency care, transfer of care, the rehabilitation hospital, Social Security, disability, Medicare. I mean, the list could just go on and on. But just really the effectiveness and efficiency of how the medical system is communicating information. So, for example, every time I see a new physician, it's up to me as the patient to make sure that my medical records are sent there. And it's quite complicated because there's nowhere in the system that my records are all in one place. So it requires me to download a medical release form from every facility that I've been to, which is 5 major facilities, but also all the individual doctors I see in my regional area, fax this information, pray that the medical records facility gets everything sent to the new person, and then have numerous phone calls back and forth because they say they've sent it, but the new facility hasn't received it, et cetera, et cetera. But it results in several problems. One, my file is enormous. So I wish I had $1 for every time a physician said to me, "Do you know how big your file is?" It's like, oh yeah, I've lived it, right? You know, so I do know how big it is, you know? And so it's hard for them. They don't have time in their schedule. It's hard for them to look at something that's so huge and find the pertinent information that allows them to get to know my medical history and to know me before we have the meeting. So that's one issue. The second issue is that facilities organize their material in a different way. And so I think for doctors to be able to kind of comb through all this information in order to find pertinent information about my case, it's very, very difficult. And thirdly, because they can't find this information, I think it results in duplicating testing. You know, I have to do another MRI or another CAT scan because they can't find the radiology report, or they just can't access the information. So that's an expense to the medical facility, to the patient, to the insurance. I mean, it's an emotional toll on the patient while they're there. So that's probably my biggest frustration with the medical system.